Hi, I'm Dr. Ken Cochran, President and CEO of Opelousas General Health System. We applaud the St. Landry Parish School Board for providing a virtual experience of career futures in light of the coronavirus pandemic. You are our future workforce and leaders. We strongly endorse the efforts of the St. Landry Parish School Board in providing optimal educational experiences that will both support and promote your future endeavors. With a staff of over 1,100 employees, Opelousas General is the third largest employer in the parish. We welcome future employees just like you. Our hope is that your interest in service and helping others is heightened after hearing why some of our physicians and staff choose to pursue healthcare careers.
As a third child, my responsibility was to nurture 3 or 4 children that were still in diaper. So as I matured to be a young teenager or even 20 to 25 years old, my heart and desire was to continue nurturing and taking care of people. I loved talking to people, laughing with people, nourishing people, caring for people, also interacting, knowing their background as a human being. Like what makes you you and what makes me me and what makes us so different. But when it's final said and done, we're all about the same thing, caring and loving people. L'amor, which is love, is more important than anything else for people. More important than money and than life itself. If you love someone with a caring and compassion heart, you will go a long way. And that's why I became a lab assistant, and I love it.
My grandmother was actually a retired nurse, and I spent a lot of time with her growing up, and we would spend time going around and helping her friends and giving insulin, and that's really how I spent my summers. So that's really how I got interested in medicine. And I always really wanted to, even though I was a kid, I liked dealing with children, and as I got older, I realized that I really wanted to help children specifically wanting to be a pediatrician.
I like working here. I was born in this hospital. A lot of my relatives work here. A lot of my good friends work here. I love the environment. I have fun with the people I work with. I love taking care of our patients. Most of our patients are from this area, so it's been a great experience so far.
I grew up in a family of actually nurses. My older sister is a nurse. She's now retired. But basically just the satisfaction of being able to help people, especially people that could not help themselves. Nurses spend more time with the patient than any other profession. We're the ones that sit at the bedside 10 to 12 hours a day. So that gave me an opportunity not only to be able to help or to take care of people, but also to get to know people. Hence, that's pretty much how I've gotten to know the entire city of Opelousas, is simply because of my work as a nurse here.
I got into my profession because I wanted to help people. Originally, I did not think I was going to be in healthcare. Worked here as a student in college, in admissions to the emergency room. Later moved over to the business office and realized I could affect healthcare not directly through a clinical, but through other means. You know, hospital has accountants, they have nurses, they have an education department. So it's a very wide spectrum of careers in healthcare that you can help and affect, patients' care, indirectly or directly.
I decided to become a physician because while I was living with my grandparents, we had to drive a pretty far away in order for them to go to the doctor. So I decided to become a doctor so people would not have to drive very far to see a doctor.
As a speech pathologist, I feel comfortable working as a board member because of my educational background, because I am people-oriented, because I live in the community of Opelousas, Louisiana. But if I had not been in education, I would not be able to do this. Education is the background, is the basis, and thank you for listening to me.
The reason I came into healthcare was because of an event in 2007. I was carbon monoxide poisoned. I had to be in the hospital with several nurses and aides and physicians, and at that point, I could have been gone. However, My purpose was to serve, and healthcare was my calling. Healthcare was my passion. And if it hadn't been for that event, that struggle, I wouldn't be here today.
I grew up in a household with a mother that was a nonprofit director, so all I ever saw growing up was her providing service. And when I grew up, I was a teenager, I worked with her a lot in cultural preservation. As an adult, I moved into working with the homeless population, with mentally ill adults. And then once I moved to Opelousas, I got the really unique opportunity to come and work as director of foundation here, where I'm able to really concentrate on community health.
As a child, I was able to observe some of the challenges that my grandmother endured as a diabetic. Whether it was administering insulin injections, trying to eat healthy, more or less adjusting to a healthy lifestyle, as well as some of the obstacles that she endured within that process. It was more or less my love for her and wanting to help her even at that age is what motivated me to become a nurse. I would say healthcare is a very rewarding career. I would encourage anyone that has a passion or even a calling for doing so to please follow your heart.
The desire to help others through healthcare was instilled in me at a very young age, and I love doing what I do because I get to advocate for health and wellness to today's workforce, but also to our community as a whole. The healthcare industry has so many different positions, different areas, different aspects. So definitely do your research, find out exactly what you want to do, and find a mentor, someone who's actually doing it in the field right now that you could shadow.
Well, I decided to become a physician, let alone a pediatrician, because as a child I was always interested in scientific material and interested in reading. And also because I had a lot of relatives when I was growing up that were sick. And they had issues finding physicians that would see them. So I always said that if I could ever help someone in that capacity, I would love to be a physician. Anyone that wants to become a physician, hold on to your dream and never let anyone tell you that it's not possible.